Namaste, myself Shivi Saxena, Faculty of Physiotherapy and Diagnostic, and my discipline is Medical Laboratory Technology from Jyoti Vidyapeeth Women's University, Jaipur. So, welcome in Digital Version 2.0. So, my today topic is antimicrobial chemotherapy. So, let's start. My topic is antimicrobial chemotherapy. So, firstly, what is chemotherapy? Chemotherapy is defined as treatment of disease by means of chemicals that have a specific toxic effect upon the disease producing microorganisms or that selectively destroy cancerous tissues. According to American Cancer Society, so the use of medicines or drugs to treat cancer. Chemotherapeutic agents. Firstly, alkylating agent. Mode of action arrests DNA replication can result in DNA damage. Example, carmustine and mustine. Anti-tumor antibiotic. Mode of action alter the DNA inside cancer cells to keep them from growing and multiplying. Example, danvaxin and actinomycin B. Anti-metabolites. Mode of action interfere with ability of normal purine or pyrimidine nucleotide precursor either by inhibiting their synthesis or by competing with them in DNA or RNA synthesis. Example, methotrexates F5FU. Next, antimicrotubular agents. Mode of action block cell division by preventing microtubular function. Example, Vinca alkaloids prevent the formation of the microtubules, and texins prevent the microtubular disassembly. The early period of cancer drug development, 1900 to 1950. First, Paul Enrich, founder of chemotherapy, discovered uh, artemisinin for syphilis treatment, and that means magic bullet. And Sidney Fabre worked on remission of pediatric leukemia using the drug aminopretrine. Adenosine, first chemotherapy drug alkylating agent, a weapon used in WWSEC, approved by FDA for Hodgkin lymphoma. The 1950s, fluorosis became mainstay of chemotherapy for colorectal cancer, and NCI demonstrated combination chemotherapy for remission of acute leukemia. First effect chemotherapy was found for men with advanced testicular cancer, actinomycin D, methotrexates, and chlorambucil. FDA approved two microtubular drugs, vinblastine and vincristine, for leukemia. Central nervous system was treated with radiation and intrathecal therapy, helped achieve first long-term cure for the common childhood leukemia. And the 1970s golden era, regarded as the age of adjuvant chemotherapy and high-dose methotrexates and leucovorin recurrence therapy, results in significant tumor decrease, almost 75% of cases. First promising chemotherapy drug, carmustine, cross blood-brain barrier, was reported for Kiloma. Doxorubicin was reported active against advanced breast cancer and FDA approved it for combination chemotherapy. Doxorubicin was found effective for liver cancer. Tamoxifen received initial FDA approval for breast cancer, but for women having tumor of estrogen and progesterone. FDA approved the first chemotherapy drug, cisplatin, for bladder cancer. First effect combination chemotherapy regimen for ovarian cancer was developed but had more side effects. Methotrexate, vinblastine, and doxorubicin and cisplatin. The 1980s combination chemotherapy was reported to improve outcome for stomach cancer and bladder cancer. Afluorescent chemotherapy plus radiation were investigated to be effective for patients of pancreatic cancer. Hormone therapy drug introduced lower prostate cancer. New adjuvant chemotherapy was demonstrated to avoid amikration in uh, children with bone cancer. FDA approved carboplatin for ovarian cancer. The 1990s, new chemotherapy, topotecan, drug for advanced ovarian cancer, and gemcitabine um, was found the modulist extend several relief symptoms with advanced pancreatic cancer. New chemoradiation therapy offer alternative to surgery for advanced disease. Surgery was found to cure some patients with advanced uh, colorectal cancer. Oral chemotherapy drug capecitabine approved for advanced breast cancer. New oral chemotherapy drug temozolomide increased glioma survival. FDA approved liposomal doxorubicin for advanced ovarian cancer. Early 21st century, new class of drug aromatase inhibitors were introduced. Direct chemotherapy approaches increased the several of cancerous patients, and addition of an arsenic compound found to improve several for rare from the form of leukemia. Taxanine therapy improved several for several types of in advanced head and neck cancers. Antimicrobial chemotherapy. So, introduction. Clinical application of antimicrobial agent to treat infectious disease, example influenza, cholera, and TB. The antimicrobial agents may be extracted from natural substances or can be produced synthetically. Drugs are given in particular doses accordingly to type of the any severity of infection. Brief history. So, ancient history, Indians used quinine for malaria, and Egyptians used honey for dressing wounds. Now we know it contains inhibin, which convert H2 and O2 into the H2O2 and antibacterial. The Chinese and Greek use bread mold to treat skin infection. They produce some raw from the from of antibiotic. Turmeric was used by Indians to treat wounds. Onion and garlic was also used in food. Modern era of antimicrobial. So Paul English in Germany developed first antimicrobial compound, salvarsan, against syphilis in 1910. Fleming discovered penicillin in 1928, a breakthrough in history of medicine. So when I woke up just after dawn on September 28, 1928, certainly did not plan to revolutionize all medicine by discovering the world's first antibiotic. In 1935, German biochemist Gerhard Domel developed the first sulfonamide, a synthetic and the first commercially available drug in name of pronostal. Selective toxicity. Antimicrobials are based on concept of selective toxicity. Ability of a drug to injure a target cell or organism without injuring other cell or organisms that are in intimate contact. Reason of selective toxicity. Drug accumulates in microbe more than in human cells. Drug is targeted against particular feature of microbe not present in host. Example, penicillin inhibits peptidoglycan synthesis in the cell wall. Human do not uh, have a cell wall nor peptidoglycan. Streptomycin target bacterial protein synthesis because bacterial ribosome 70S are different from the ribosome 80S of human and other eukaryotic organisms. So, tetracycline is used to treat exin and cholera. Okay, type of antimicrobial therapy. So, four type of antimicrobial chemotherapy. So, first bacterial chemotherapy, antiprotozoal chemotherapy, antifungal chemotherapy, and antiviral chemotherapy. Antibacterial drugs. So, used to treat bacterial infection, example tuberculosis. Broad spectrum antibacterial are active against both gram positive and gram negative. Example tetracyclines and phenolcoils. Narrow spectrum antibacterial have limited activity and are only useful against particular species. For example, glycopeptides and bacteriocin are only effective against gram-positive bacteria, whereas polymyxin are usually only effective against gram-negative bacteria. Antiviral drugs so stop development of virus in host, example HIV, influenza, herpes simplex. So Aclovir and amantadine. Antifungal drugs to treat fungal infections such as anthrax, food, ringworm, candidiasis, serious cryptococcal meningitis. So amphotericin and ketoconazole. Antiprotozoal to kill single cell infective protozoans like Entamoeba histolytica, ulcer of intestine, and Plasmodium malaria, like malaria, Trypanosoma brucei, sleeping sickness. So, tinidazole and nifurtimoxone. Antimicrobial resistance. The loss of efficiency of antimicrobial agent. Resistance against penicillin was first reported in 1965, caused because of obvious or insufficient doses. So mechanism due to drug inactivation and destruction, target site alteration and increased removal from the cell, and inhabitation and as a result of metabolic byproducts. So thank you. This session is completed. And any query mentioned in comments box. Thank you so much. Namaste.